Denver's businesses are supposed to be in compliance with the new COVID-19 restrictions as of 1 hour ago, 5 p.m. The move by the city seems sudden only to those who have not been watching the numbers. Our Nusha Roy was.
The alarm was sounded a few weeks ago that Denver's COVID numbers were not looking good. On October 16th, roughly 2 weeks ago, the city of Denver announced new public health orders to try and reverse that. Thursday, we touched base with the city.
We just issued our newest public health order, and the feedback that I've received from the state health department is that they are very pleased with our efforts to try to control our numbers here, and they want to give us an opportunity to do that.
The city had a scheduled meeting with the state health department earlier this week and told us things can change quickly, and by Tuesday came the news.
Due to the dramatic rise in our average daily case rates, positivity rate, and hospitalizations, Denver will be moved backwards to the state's dial system to safer at home level 3.
The Denver Department of Public Health has been working with the Department of Safety, deputies, and police officers for enforcement. Denver police said their goal is still voluntary compliance first. This time around, the city is adding more people to the pool to monitor if people are following the rules.
In addition to making sure businesses are following the rules, that you guys are making sure that there's more focus on what people individually are doing in public, whether that's the park or on 16th Street Mall.
Yeah, that's correct.
The city will take into account people need to get caught up on the new rules, but said for violations of requirements that haven't changed, we will still use enforcement tools to address significant violations. The city's next check-in with the state health department is in 2 weeks.
To get back to level 2, we must reduce our average daily cases, positivity, and hospitalization rates back to levels allowable for it, and then hold those reduced numbers for 2 weeks.
There are more than 20 counties across the state right now either working on stricter rules or mitigation to try to reverse the trends of their COVID numbers. That includes Adams and Arapahoe that are moving to stricter levels today as well, followed by another 2 counties, Kyle, by the end of the week.
Anusha, we've talked here about the necessity for there to be clear guidelines for people so that we know what are the rules of the game. When are things going to change?
Yeah, so what the state health department said when we asked them that is that there's 3 main metrics that I'm sure a lot of people have heard about, right? Hospitalizations, positivity, and your caseload. And essentially what they're saying is if those 3 metrics are met for 2 weeks, then that's when the state is going to start talking to public health agencies and looking at unique factors within their community and then start talking about any possible changes to the levels.
The 3 main metrics we cover here almost nightly. Anusha, thank you.